I always thought that was interesting. Barbecue on Guam. When we say barbecue in the States, barbecue is a method of cooking, right? It's how you cook food. In Guam, barbecue means social gathering. So what is okay is you can barbecue to cook your food, okay?
As long as you're by yourself.
Yeah, with your household, okay? Don't deprive yourself of good barbecue during this pandemic. Your body needs it. It's essential. 7:49. Let's go to our KUM News Zoom room again. Where we have public health. We have Annette Uggan, who's with the contact trace team, and then we have the state epidemiologist, Dr. Ann Pobutsky. Good morning, ladies. First of all, I just want to start, and I want to apologize to you two lovely ladies for the comments, the disparaging, hurtful, misogynistic, sexist comments that Dr. Akimoto made yesterday on this show. I run the board in here. I'm responsible for what goes out over the air. Unfortunately, I was doing a lot of things. I didn't get to catch it in time, but totally uncalled for. Totally disagree with, the tone and obviously the name calling and the cursing. And I just want to say on this show that you support what you guys are doing. We had our share of missteps, but I know you guys' heart in the right place. You're just trying to keep people safe out here. And I'm sorry that through Dr. Akimoto's comments that your entire department, got caught in a crossfire. And I apologize for that.
Thank you, Chris. We appreciate that. And I also appreciate, Dr. Wen's comments as well. And, yes, it's unfortunate, but we will push through it and move on and focus on what we need to do, which is to protect the people of Guam and keep our island safe and flatten that curve.
Right.
So thank you.
Nobody got a day off because of this, right? You didn't wake up and you're like, oh, do we get the day off because of what, doctor? No, we still got to go to work. So let's we'll start with you, and I want to do a little different. We'll give you the floor. Just give us an update, what you think we need to know, both of you, and then we'll jump in with some questions.
Start with it.
We'll start with, whoever.
What's the question?
Would just give us a where are we at right now, Ann?
Where are we at right now?
Yeah, that'll work.
Well, as everybody knows, there was a doubling of cases in August. This is a major surge and a doubling of the deaths. So that's what we're dealing with. And as Dr. Wen was talking about, they're associated with household contacts are very common, funerals, family gatherings, and there is some workplace transmission. All of this is local transmission. These are not people coming in, except there were some for a funeral earlier in August, and that's what we're dealing with. And we understand that people are fatigued by these restrictions, but it's a big problem. And what we have seen driving this, 57% of the cases were among those aged 20 to 39 in August. That's almost 2/3 of the positive cases. So it's young people driving this. We understand people are fatigued by the restrictions and they don't want to follow them. Everybody wants things to open up, and it just can't happen, because what happens is people die. And Dr. Mangloni has been very articulate about what the issues are, and it is the responsibility of the community. We can only do so much. We're just one agency trying to address this pandemic, and people do need to continue social distancing. I think Dr. Wen was right, talking about the store. Everybody's 6 feet apart, and you have to wear a mask, and you're sanitizing your hands. But he's right. Don't bring your family to the post office. Don't bring your family to Payless. Go in, get your groceries, head on home. Let's sit out this new lockdown and see what happens. See if we can make a dent in driving down the infections.
Let me just ask.
So that's what's going on.
Right. So let me ask this. What we're seeing now, how dated is this info? From how far back are the positives and the hospitalizations? How far back are we tracking this? Because this is not the result of things people did yesterday, right?
No, we've been tracking this since March. We have a daily tally of cases. You can go on our website and see it. You can also see the graphs that our Epi surveillance team is putting together. Stephanie has a graph, and she plots you can see the surge. Go on the dashboard and check it out. You can see the August surge, the jump in cases. And yes, Some of this stuff started back in August, but then, the lockdown hasn't been for very long. It's only been, a week now?
Yeah.
We're going to have another week. You're not going to see the results of this so-called lockdown until a few more weeks. And the hospital's full. That's the other issue. This thing surged out of control. It flared up. We're seeing more deaths. We're seeing more hospitalizations. The hospital's full. We don't want people to get sick and end up in the hospital. And those people who are older, middle-aged, you're more likely to have chronic conditions. That's who ends up in the hospital. Yes, we do see a few cases of younger people and one death, but it's mostly the older people with chronic conditions who are going to end up with severe outcomes and or death. So if you're young and you're wanting to go out, think about the rest of your family members and especially your manamko. Stay home.
I think what Chris was asking was just clarification on, so we could have the test results from yesterday, for example, but how old or where did that batch come from? Was it from a week ago? Was it from the ones that are in the freezer?
Yeah. I think that's
Actually, I'll let Annette handle that one.
Yeah. Thank you, Annette. So a lot of people are asking, Annette, with these results that we're getting, how many of them were from the mass testing and how many are current, just so we kind of know better where we're at right now, which, we're screwed, basically.
We are current. We no longer have a backlog. Sunday, Public Health caught up with what they had, and then on Monday there was a remaining that we sent out to our partners at DLS and GRMC to help with the testing. But we have been caught up. We have no pending as of last night. So as the clinics and the hospitals, as well as our quarantine swabbing submitted their specimens, lab has tested it, and so as we have been current these past few days, and so these are new cases with recent infections who presented themselves to the clinic, or they were identified as close contacts and came in and were swabbed through the Northern Community Health Center. And so again, we are seeing new cases, new contacts. GMH also is the one being inundated. So they're the ones, unfortunately, throughout morning, noon, and night, they are nonstop reporting to us. We have another positive, and it's different age groups. And so we have, again, like Dr. Wen mentioned earlier, some are mild symptoms, but they're going to the ER, which is already saturated, like he said. And so again, if you're having symptoms, but they're mild, please go to your private physician to be evaluated and tested so that GMH can definitely focus on those with more serious complications or symptoms.
Annette, are you guys caught up on calling people and giving them their results from the mass testing?
No, that one we are still working on, sir. I know that last night the nurses were saying, we're dealing with emails and phone calls. They're calling all the way up until 10 p.m. at night to inform individuals of their results. So, but as the results are coming out from our laboratory, the nurses are getting that so that they can inform the individuals. So that one is, they're dealing with hundreds per day. I know at one point, one of our nurses mentioned we had like 680 calls in one day, and we are, from morning through night, we are dealing with it. The call center is assisting us, and then we have nurses doing work from home, after they clock off at the community health centers or their assigned duties, be it at the ISOFAC or the quarantine fac, the quarantine units. Those nurses are also assisting by calling into their night, just so we can inform the individuals of their results. But the positives, once they're positive, they're informed right away.
Okay.
Right. And I can give you some of the numbers. We're trying to publicize that today, or at least get the numbers crunched.
Please
from
do.
the mass testing from April through July. We only had 42 positives out of almost 7,000 tests. I believe it was 6,808 tests. The month of August, we especially that was just that one test, almost 1,500 tests and 120 something positives. I'm trying to sort through the numbers right now, but that's clearly a reflection of the surge. Whereas before we had almost 7,000 tests and only 42 from the mass testing, and now we're seeing 120. So out of 1,500.
Ladies, stand by just a sec. I'm going to sign off. KUAM TV 11, our Friday audience. Thank you guys so much for watching the show. on KUAM TV 11. It's continuing, as always, on the Breeze, 93.9 FM on the radio, or you can jump on our KUAM News Facebook live feed, where we will continue the interview with Public Health's Annette from the Contact Tracing, and Dr. Pobutsky, who's the state epidemiologist. Okay, thank you guys. Hasta, adios. Have a good weekend. Be safe. Jump over here.
Stay home.
Stay home, yeah. Okay, so where were we?
I was going to ask, have you guys had that moment yet where, you keep seeing this increase and this surge and you're just like, what the hell are we going to do? I mean, I know I've had that quite a few times in the morning, and Chris has had to deal with my craziness.
We're all going crazy. I mean, Annette, maybe more to you, but God, I almost feel like if it's so widespread north to south, we're seeing it at businesses, at schools, and I mean, are we even contact tracing anymore?
Do we need to?
Do we need
to? It just seems like everybody's got it.
I just would be like, God,
Yes, we are still doing our investigation and contact tracing, and yes, these numbers are overwhelming. Our staff are doing the best they can with what we have in front of us, and day in, day out, through the night, and even on weekends. My staff have no life besides work, go home and rest and repeat the next day. But we are pushing through as best we can. We are working with the new cases and their contacts to get them, interviewed and swabbed, get those new cases isolated, get those people contacts into quarantine until they are able to get tested, and to complete the 14-day quarantine period. It is a daunting task, but again, that's why we reach out to everyone that we can't do this alone. It's an individual responsibility, organizational responsibility, and a community-wide responsibility. Mm-hmm. And again, we just push through. We won't give up the fight. Yes, there's been a lot of questions of when is enough? When do we just say, okay, throw up our hands and quit and hunker down? But that's not how we are, the people of Guam. We are resilient. We fight. We, when we come back, we pull together the infant Malik. And so that's something that, again, we are pleading with everyone. Do your part, help us do our part, and we will get through this and flatten that curve.
But Dr. Ann, do we really need the contact tracing? Because it just seems like it's everywhere right now.
No, we still need to continue doing what we're doing and do the contact tracing, because there have been several significant clusters that we need to address. But again, those are associated with churches, funerals, gatherings at bars and restaurants, and all that hopefully has been shut down, and the infections will decrease. The biggest problem now is our capacity at the hospital to deal with severe cases, and that's the issue, and that's the problem. We can't just have everybody open up everything, go about their business, and the infections are going to go on. Then you're going to see more deaths. It's what we've seen in 2 weeks. How many deaths? 5 in 2 weeks, and this major surge. And that's going to continue unless people start restricting themselves again.
Ladies, let me ask you about this. So we had one of the deaths was an elderly man who he was brought from home, transported in the ambulance.
He was dead on arrival.
He was dead on arrival. Had COVID. Are we concerned at all about people who are staying home and have caught the COVID real bad and they haven't been tested, and they're popping up? I mean, showing up dead on arrival, or either severely ill.
Yes, some of the physicians on the Governor's Physicians Advisory Council have talked about that, particularly elderly people, people with chronic conditions. If you're sick, don't wait. Go see your doctor, or if you're really, really sick, shortness of breath, et cetera, and you have diabetes, or you have a COPD or other chronic condition, yes, go get seen. And wear your mask and do what needs to be done, because yes, there's anecdotal thoughts that the doctors are saying people are waiting, and we're more concerned about those who might have severe outcomes. So actually, a person at any age with a chronic condition would be at risk.
And Annette, let me ask you: when you call people, or when your team calls people and they're positive, especially in this climate where, like Dr. Ann has said, the deaths are doubling, the positives are doubling. What are these people saying when you get them on the phone and your team has to break the news to them that they're COVID-19 positive?
Annette, I'll let you take that one.
Some of them are actually relieved because now they know. Some of them have suspected they had COVID because they're symptomatic, and so they're really concerned about their family and their coworkers or who else they've been with. And so, by them knowing that they are confirmed, we give them the education and the guidance on what to do next and how to coordinate with the people that they've been in close contact with. There are some people who unfortunately are hesitant to share who had they been in contact with because of the negative backlash that they're going to get, and so we just have to work with them and continue to advise them that it's not your fault. It's no one's fault to get this virus. It's something new and we're all dealing with it, but we definitely need to inform your family, friends, or coworkers or other people you've hung out with during your infectious period so that they know what happened and that they're possibly exposed and that they take the necessary precautions to quarantine and to be tested and to monitor their health. So again, the people of Guam have been very helpful. Again, it's a partnership. We can only help you if you help us. We need the information from you so that we know who are the contacts and where you've been so we can notify these individuals so that they can take the necessary steps and we can help you with setting up a testing date. So again, we can verify through your exposure, have you been infected? And so the people who have been contacted, they're actually calling us. There are some who, so-and-so told me they're positive and now I'm a contact, can I get tested? And so again, we have to wait to the formal report and then we work on that because again, we've heard in the past false rumors about someone being infected. And so again, we deal with all these calls, people reporting to us. But again, we need to verify to official report that the person is positive. And then we'll call those individuals back and say, okay, no, that's, the information you heard was either inaccurate, they're not positive, or yes, unfortunately, you're correct. And now that we have the official report, we will initiate our interview with you and coordinate scheduling and have you quarantine, and what's the time frame you need to stay home.
Doc, you keep on bringing up, and I know that we've talked about this on the show, about we need to watch what's happening at the hospital. And the numbers from the SIT report, 38 people hospitalized at GMH. They're talking about the Surgery Center, I think, sending the telemetry patients there so that they can open up more space in the telemetry ward. They've opened COVID Care Unit 5. How close are we to just a complete lockdown? Nobody goes outside for X amount of period of time. Are we close to that point where we need to see that happen?
That's the governor's call.
Right, but in
From
your
a public health standpoint,
yeah, are we close to that point?
Yeah, because it just seems like I was thinking yesterday we're teetering on the edge. I mean, we're just a few steps away from patients in the hospital, in the hallway, outside. I mean, we've seen this nationally.
Mm-hmm.
So just from a public
Right.
health standpoint, as we try to, like Dr. Manglotnia says, put out this raging wildfire,
Right.
when does it reach a point
Well,
where we
that-
say, hey, you guys running around?
I don't know. Let's see what happens. Let's
Right.
see what happens. We've had 1 week of a kind of a lockdown, and let's see what happens. As she's extended it, the governor's extended for another week. Let's see what happens with the numbers.
Okay.
Annette, what's the status? So we're getting a lot of comments. People want to know what's the status with testing and what type of testing is available. We heard a little bit from Dr. Wen, just so from public health, who can get tested? When can they get tested? Where can they get tested?
So with public health, we continue on with the testing of identified contacts. We schedule with the Northern Region Community Health Center nurses to have them come in on specific dates. And so Northern has been averaging just over 100 per day. And so they're taking our contacts that are identified, as well as those they do have for symptomatic individuals that they schedule, as well as a few slots are for for the travel clearance because they have to go off island. Yes, it's unfortunate. Dr. Wen had mentioned with DLS is currently down with their reagents. Public health continues to test. We have our supplies. We're all caught up, as I mentioned earlier. We continue to test for those who are in the quarantine facilities as well, and those who, again, identified as close contacts. So we are currently able to provide testing as needed for all those that we are handling and been reported to us as contacts. And so it's just DLS, our partner, is waiting for their supplies to come in. GRMC2 has helped us, but they also are seeing our own clients for testing, and so they continue to do that in-house while we're waiting for this restock for our private partners. But public health is available for testing, and we have our test kits and our reagents.
So just so people don't freak out, how many tests are you guys anticipating being run today when we get the end of day results that we normally report? Because we're seeing, significant tests being run, and I'm just wondering, are we going to, for lack of a better term, fall on our face tonight and get like 30 tests?
No, we normally average 100 to 200 specimens delivered to our lab. Last night we tested just under 300, and it was the first time in how many weeks that my lab staff got to go home before midnight. They caught up, and we finished way earlier in the past week and a half that they've been burning the midnight oil, getting these tests all the specimens tested. I'm sorry, and so our capacity is there. We have our test kits. We again also have a new contracted microbiologist on board, thanks to the Pacific Islanders Health Officers Association. In the midst of our surge, they stepped up and expedited a hiring of another microbiologist to assist our team. So that has helped augment it. And again, we are ready and standing by for whatever specimens are brought over. And normally, quarantine facility alone, we're usually 50 to 100 that are delivered to us for testing. And so we're just standing by, and even for like GMH and the other clinics who do not have their own Abbott machine to test their clients, we are standing by to receive and assist as needed.
Okay. So we may not see a high number of people testing positive, because we're not going to be able to test as many or run as many samples.
At least until Tuesday.
Right.
Not necessarily test positive, but again, we're also focusing on those who are symptomatic and those who are contacts. So it's a targeted testing.
Yeah.
If we get a number, we just have to see a number. Yes, we are seeing household members becoming positive, and it's to be expected if you're living in the same house. If you're not able to also do the social distancing within the house, and so we're hoping to see the numbers go down. We've been hitting the double or triple digits these past week. And so again, only time will tell. This lockdown has, helped us with flattening the curve. But like Dr. Ann said, it's going to take maybe another 1 to 2 more weeks. We just started this lockdown.
Yeah.
And so for us to turn the tide, it takes time.
Right. Dr. Ann, you'd mentioned, we know, all right, the family, the household spread, but you'd mentioned a couple clusters. Can you give us any info on that? As you know, we kind of got used to getting that type of info way back, where they revealed, there was a cluster here, a cluster there, here a cluster, there a cluster, everywhere a cluster. So what clusters are we looking at? Because I've heard some things. You mentioned church cluster.
Yes.
Yeah.
And funerals and bars and restaurants. And Annette can talk about, we're not naming all of these places.
Okay.
Some of this happened 3 weeks ago. So it's not like we have a list of don't go here, because obviously some of these places are fine now. It happened 3 weeks ago. So we're not naming names. We're waiting for an opinion from the Attorney General's office on releasing information about specific establishments. But we do know the restaurants and stores have been very good, and the workplaces about, if there's a positive identified, they clean up their store or their workplace. The person goes home and is isolated and that sort of thing. So, and people may be tested if they're close contacts, and then we move on. And some of these clusters have been limited to, say, 2 or 3 or 4 people, and then it doesn't become a giant cluster or outbreak.
Right.
So we've had several of those where it stopped after 2 or 3 people because people are doing what they're supposed to do. isolating at home if they're sick, complying with home quarantine, etc.
Annette, could you just walk us through, like, on the typical, right? So let's go with a bar, for example. When you have a cluster that associates from a bar and you do your investigation, how does it start and how does it spread?
So it's based on the interview and the information that we are able to get from the cases of where they've been, who have you been with, and then we start to connect the dots. And to be clear, like what Dr. Wen had mentioned earlier, and it's not the place, the bar, the restaurant, the establishment. It's the individuals and where were you before you went to that event. That location just happens to be the commonality. So when we find out information is, oh, okay, you guys went to that bar, but you're from different households. You know that's the common point where you were together. You hung out for so many hours or whatever. So it comes back to, oh, were you guys wearing your mask or not? Did you practice the social distancing? So the location, the establishment, they've stepped up. They've done their part. So it's not on them. It's you going out and who were you hanging out with. But prior to that, who were you with and possibly exposed to, and not realizing that you were infected because you're feeling fine, you're young and healthy, and you went out. We've had instances where the bar was just one place. Then they went to a restaurant. And then, okay, so there's some overlap where we found cases that in more than one location, they hung out together, be it a bar, restaurant, but we also had a party at our place, barbecued at my house or at my cousin's house or my friend's house. And so there's some individuals where 3 or 4 places their paths crossed. And then unfortunately, people who were with them at those locations were exposed, brought it back to their families and their coworkers. And so that's why to pinpoint a location, it's widespread on Guam. We're seeing it. And like Dr. Wen had mentioned, it's the family. It's you going out and about to other places, going to work, but you're hanging out with people at home. You're visiting your own family and friends at their homes and not realizing someone was infected and now you're exposed, or you're symptomatic and you're still going out and about as if nothing's wrong. You're still going to work while you're symptomatic. And so that's been the very frustrating but common theme that our investigators and contact tracers are hearing. Oh yeah, so-and-so was sick, but we just had a small barbecue. It was less than 10 people, but they were still sick and you still had to get together. And so again, that's why we don't want so much focus on which bar or restaurant. It's the fact that people were not staying home, not washing their hands, not wearing their face mask, not doing the social distancing. And the location just happened to be where they were at the same time, but then they ended up going back home or back to work. And that's how we see this spread.
Thank you. Let me ask you this. We had a question on the phone that came in. Flu season, right? So we're telling people who are symptomatic to go get tested for COVID-19. Are we worried that some of these people may just have the flu? And how do we differentiate between what could be the flu and what could be COVID? Or do we just test everybody who's got a runny nose?
No, there is also a rapid flu test that clinics and labs can conduct, where in a few minutes if it's flu or not. And so that's something that happened in the beginning where, are you sure it's not flu or is it COVID? And so people were able to say, get a flu test. And if you're negative on the flu, then you highly suspect it's COVID. Yes, flu season for Guam, we're tropical, we're throughout the year. Our flu season is different than the mainland, where they're mainly in December, January, February, wintertime. For Guam, we normally see it this time of the year, right, when school opens, when rainy season starts. And so another big push that we will have to do while we're still dealing with COVID is to increase our annual flu vaccination. And that's something, when the flu comes in, public health with our medical partners in the private and public sector, the people at large, we need to really push to increase flu vaccination to prevent the spread of flu while we're still dealing with COVID. And we want to push that until we get the COVID vaccine out. And so that's something that is coming up in the next month or so when we get those flu vaccines received, that we will be working with our partners, the frontline, the healthcare workers, law enforcement, as well as critical infrastructure, to get them protected against the flu, so that we can help differentiate, because, oh yeah, you got the flu vaccine, so this is most likely COVID. And then we definitely want to protect our elderly and those who are high risk due to any type of medical condition. We want to protect the young. You know, the flu vaccine is we can give it as young as 6 months of age. So again, we need to have widespread immunity for flu, so that we can ensure we don't have a surge in influenza infection while we're still dealing with COVID infection.
Right.
Yes, we don't want two twin epidemics.
Right.
They call them a syndemic when you're having two at once. We're also still worried about dengue. We don't know if it's going to surge this fall. We just hope people aren't breeding mosquitoes in their yards with all the rain we've been having.
Wow.
Yes.
Dr. Ann, let me ask you this, because, and you know, just in layman's terms, for some people I talk to, it seems like the COVID now that we got that's spreading, I don't know if it's reached that point where it's just so widespread and we're seeing a different cross section of people get it and not do good against it. Is that the case, or is it that has it evolved into something more dangerous, or is it just that it's spread so much that, like Dr. Maglonia said, it's burning everywhere? Because I mean, it seems like people caught it early on. I knew some people who had it and was like, okay, fine. But now I know young people who work out every day, who are healthy, who do the dieting, and they're getting like slammed by this thing.
Yes.
Yes, we do track these numbers by age, ethnicity, and et cetera. And we do see August was almost 2/3 of the new cases were people aged 20 to 39. So young people were spreading it. They've obviously spread it because of these gatherings, funerals, et cetera. And some elderly people have acquired it and then ended up dying. So I think we can still track what's going on and hope we can not, simmer it down again. So it's at a very low rate. I don't even know if kids will be able to go back to school till next year. I don't even know if that's possible, because if young people are spreading it, we also saw in July an uptick in the under 18 group.
Right.
And that was up to like 36%. And then it went bad. It was 50%, 56% young people in June, and then that kind of decreased, and the 0 to 19 group went up, and now it's back up to the young people, 57% in August. So we are tracking that, and if we can get people to simmer it down and stop infecting other people with it, I think we might be able to get a handle on this. And again, as Dr. Manclonia was saying, it's the community's responsibility. Dr. Wen was saying, don't take all your kids, don't take the whole family to the store. Just get one person go to the store, get supplies and toilet paper and food, whatever. And don't have any parties. Sorry. We have to social distance and wash our hands and all the stuff we need to do, and isolate the sick and stay at home if you're sick, especially. And this is what Dr. Manclonia used to say early on in the epidemic. When we didn't have enough tests, people would call in and say, I have this, that, and the other thing. It's like, you know what? You probably have it. You probably have COVID. Stay home and isolate yourself from your elderly relatives and hope that you recover. The problem is, some people get it and they get severe consequences and they end up in the hospital. And again, that's where the problem is with people with chronic conditions at any age, elderly people, et cetera. So we're trying to simmer down the use of the hospital. At the same time, if you're really sick, go to the clinic, go to the hospital. If you have the sniffles and you're 25 and no other symptoms, maybe you have it. Stay home and don't party with your friends. Play with your phone, watch videos, read a book.
Wipe your phone.
Read a book. I like that. Read
What's
a
that?
book.
What's a book?
Well, thanks,
Talk to
Dr.
your friends, social media, whatever.
FaceTime.
Dr. Ann, we'll get to Annette right after you, but in closing, right, because I know you're busy from the epidemiologist standpoint, what's your closing statement to the people of Guam as we head into another week of lockdown?
Well, everybody should just bear with us. We're also trying. I'm supposed to get my vehicle inspected so I can register it. I can't do that. I can't buy potting soda. Yes, we know. You'll all survive this. As long as you have food, you're taking care of your sick relatives, your plumbing works, take care of business at home, and just wait this out until we can get a handle on it and hope it simmers down again. That's what we're hoping. And if not, they'll probably have to do other kinds of drastic measures and call out the Guam National Guard, have a tent hospital. We don't want to see any of that. Homeland Security taking over, and, it's possible. Army tents like the 1918 influenza pandemic. We don't want to see that. We'd rather see people just taking responsibility and doing the right thing for our community.
Thank you, Dr. Ann. Annette, before we get to your closing comments, is there any word at all about any community testing? I'm sorry, the comments are blowing up about community testing, and I know we've kind of tabled that to focus on this raging wildfire that we have going on now, but I think it's a valid question, and people are wondering, because we've done it all the way up to this point. Is there any effort in the works, or are we just not even talking about that yet?
Yes, currently mass testing or casual testing for anyone who just wants to get it is currently postponed. We are focusing still on the targeted testing of our identified contacts, as well as those who are from quarantine, recent, arriving travelers, those who are symptomatic. So right now we ask the people for their patience so that we can do targeted testing, so that we can focus on those who, if you've been identified as being possibly exposed, we want to make sure you're tested within those 5 to 7 days from exposure, because that's when we most likely will see any symptoms starting, or, your body responding to that exposure. And, that's something that, again, targeted testing is our priority right now, and that will help guide us in the next couple of weeks, whether do we need to go back to doing community testing. We have very limited resources. You heard DLS is currently out. This is the second time that they're waiting for their stock to be replenished, and that's also coming from Hawaii and the mainland. It's not just Guam that they're out. It's it's a bigger problem than just Guam DLS being out. And so again, we want to focus on the testing so that we don't have that delay that we encountered back in August 15. We did a mass testing August 15. It was the first time that we opened up to other private partners to help us on the same day, right. And we were overwhelmed. We had an overwhelming turnout. I mean, it was great, people wanting to get tested, but then the backlash came because, now we're backlogged in doing the testing, it's taking too long, and so we don't want to repeat that. We learned. Moving forward, we learned from that. We adjusted accordingly, and so we are doing targeted testing for the high-risk groups, our frontliners and contacts, those who are symptomatic, and those who travel from a place that is non-risk.
Dr. Anna, if you're still there, just really quick, because I saw this article yesterday about people, and I'm pretty sure you saw it too, people who have had COVID, and now there's a case, I think in Hong Kong, where a guy has tested positive for it 4 months after his first test. Do you know anything about this? Because people were asking, if we've had COVID, can we catch it again? And I know this question came up way at the beginning of the pandemic, and the science was just all over the place. Has anything changed with that, Dr. Ann?
Well, that particular article was published, and I believe it was published prior to, elaborate peer review. So this is like public health by media. So yeah, there might be a case of somebody who got reinfected, but I don't know what the details are, because it could be that the person, I believe he was asymptomatic, but he still maybe had dead virus inside of him. And it's entirely possible. And the planet, we have 24 million cases, and we found one guy who was reinfected. That's very possible. And it could, and we've also had some odd cases where people have no symptoms and they keep testing positive. So It's something we really don't know about this virus. And the scientists are trying to figure out, what does it mean for the future? And it's very likely, there's a good article in Science if you want to read about that particular issue. Okay. And they talk about how this it's not clear exactly what's going on with that. And, that's a good question for Dr. Manglonia, because we just don't know. But most of the scientists in that Science article were saying, but you probably, if you get a second infection, it's not going to be as bad as the first, because there is evidence that people can get immunity to at least some. Right. And we just don't know a lot about that. And we're trying to, in our proposals over the next year, to do actually more of this serology testing in our community, so that we can find out who has antibodies to the virus. And we're planning that in conjunction with the University of Guam.
Wow.
Public Health is partnering with them. And there's going to be other tests available, we hope, soon. Saliva testing they're working on that at the lab. Antigen testing. So there's a number of other things that are coming into play in addition to just this PCR test that determines whether you have the virus right now, the molecular test for the presence of the virus. So there's other testing that's being planned. And please, if you're elderly or sick or have a chronic condition, get seen if you need to. We will test you. We're also, as Nanette said, the contacts, the people who are symptomatic, people in the hospital, quarantine, we're doing all that. We're just asking the public to be patient until we can get the mass testing up and running.
Thank you,
Again.
Doc. Yeah.
Has there been any? Have you guys looked at the study that the CDC did with the military, with the serology testing study that was done with the TR sailors?
Yeah, I saw the article, but I don't know the details. Yeah, they did find a very, I believe, I can't remember. I'm not going to quote something I can't remember right now.
Okay.
Okay. Annette?
No, she dropped
She's gone. Okay. That's what Dr. Ann, thank you. And I guess the takeaway is, instead of worrying about things we don't know about COVID-19, there's plenty we do know, and that's already scary enough. So I got you.
Right.
I did want to
Exactly.
follow up though, since Chris is allowing me to ask a question.
Oh, wow.
Dr. Hoa, I asked him about the Consolidated Isolation Facility, and he said that would be a public health question.
That's more of a question for Annette. I don't know the details about what's going on with quarantine and isolation.
Okay. Thanks, Dr. Ann.
Thanks.
Okay. Be safe. Wash your hands.